Welcome back to Neurodegeneration Awareness and Artificial Intelligence, the podcast where we explore the frontiers of neuroscience, artificial intelligence, global health. I'm your host, Dr. Sukant Khurana. Today's episode is from Lagos to Nairobi, African tech hubs pioneering affordable brain health AI. We are joined by exceptional panel, Sohit, who's a bioinformatics and an AI researcher, entrepreneur. Kanak, she is working on neurodegeneration. Sahil and Aditya, who are AI researchers, and Sahil is already a full-fledged part of IronCure team. Aditya has been volunteering. We're very happy. We have Dr. Kanis Fatima, who's been associate professor in India and has been a research fellow in Malaysia, has sort of a long experience, a decade of experience in psychopharmacology, phytoconstituent based drug development, nanotechnology, and is focused on brain health and has been exploring opportunities in Middle East to transform the brain health scene there. So, Sohit, let's set the scene. Africa's tech ecosystem is booming with hubs from Lagos to Nairobi and beyond. How did these hubs become centers for health AI innovation? And what makes their approach to neurodegeneration unique?
Yeah, so Dr. Sukant, also Africa now boasts over 650 tech hubs with cities like Lagos and Nairobi leading in health AI through frugal innovation, creating impactful solutions with limited resources. Hubs like Yaba's CC Hub and Nairobi's iHub collaborate with universities, hospitals, and communities to co-design AI tools that work offline, use local languages, and are very robust in low-risk settings. The solutions are affordable, accessible, and adapted to the local context, making them globally relevant.
Well, that's really quite a transformation that Africa has seen. Kanak, how do these hubs collaborate across borders? And what's their impact on broader African health landscape?
Yes, so collaboration is the key, and networks like AfriLabs and the African Union Innovation Hub enable sharing across countries. And universities and hospitals co develop data sets and software, and cross border participations are also there, which accelerate the problem solving innovations. And this foster African led innovation that is representative, effective, and scalable, closing global research gaps in neurodegeneration.
Okay. Aditya, what kinds of affordable, context driven AI solutions are emerging from these African tech hubs for neurodegenerative diseases?
Uh, African tech hubs are creating low-cost MRI analysis platforms to mobile-based tools for gait and speech analysis. These innovations are optimized for offline use and trained on local data. Some projects even integrate herbal compound databases for drug discovery, reflecting a unique synergy between traditional knowledge and modern AI. It's affordable, adaptable, and deeply rooted in local context.
Well, that's very good. Sohit, what technical strategies are used to make these AI tools robust and accessible in low resource environments?
Yeah, so frugal AI is the strategy. Smaller, efficient models that run on basic devices using quantization, pruning, and transfer learning. Offline functionality, local language support, and federated learning for data privacy are essential. These tools or techniques ensure they work reliably and ethically across varied settings.
Kanak, how are these tech hubs ensuring that these AI solutions are adopted and sustained at a community level?
So, at that level, they involve end user, health workers, patient, and caregivers in design and training. And the interfaces use visuals and local dialects and the health education is integrated into the rollouts. Moreover, the
Uh,
partnerships with governments and NGOs secure funding and embed AI into primary care systems, ensuring long term use and trust.
Aditya, what funding and policy models are helping these tech hubs scale?
Public and private partnerships are driving sustainability. Governments like South Africa's are backing health AI, while foundations fund early stage pilots. Capacity building through programs like AI Bond and African university collaborations ensure homegrown talent sustains the growth. Ethical AI policies focused on health equity make scaling smoother.
Sahil, Africa's tech hubs are now global examples of ethical, frugal innovation. What's their significance on the world stage?
Yeah. So their impact is global, like offline apps and low-cost diagnostic tools developed in Africa are now used in Southeast Asia and Latin America. So the community-led approach sets a new standard in inclusivity and effectiveness. Africa is not just adopting tech, it's leading in designing smart, fair, and accessible AI for the world.
Well, Dr. Kaniz, based on your expertise in pharmacology, how can AI innovations enhance medication strategies in these settings?
So AI acts as a smart assistant to enhance medication strategies in these settings. First, it personalizes treatment, like Lego's Neurodose app, which adjusts levodopa dosing in real time using tremor data captured through patient phone camera. Secondly, with locally plant-based compound, AI help identify neuroprotective agent. For example, Nairobi researchers are using AI to study India's traditional gastro plants, uncovering compounds that may protect dopamine neurons. Third, it makes drug more effective. South African trial shows that nanoparticle wrapped levodopa delivered in cassava starch capsule allows for once daily dosing with fewer side effects and improved adoption. So basically, it is also increasing the patient compliance. Together, these innovations offer personalized and country ground and resource adapted treatment strategy for Parkinson's patients in rural Africa.
So, do you see potential for deeper integration of traditional medicine into AI-driven brain health ecosystem?
Absolutely. AI can analyze ethnomedicinal databases and identify promising pointer constituents. This builds scientific rigor with cultural familiarity, improving acceptance and outcome. Combined question with AI create holistic patient-centered health strategies, something Africa is uniquely positioned to.
Well, thank you to our brilliant panel for this extraordinary discussion. God, and stay tuned for our episodes to understand how neurodegeneration awareness is changing across the world and how it is changing with help of AI. Thank you for listening. Please subscribe, like, and share. Bye bye for this time.